All right, we are coming at you live from Old Greenwich, Connecticut, offices of Elite Health Services. This is the 5th episode of Elite Extra, extraordinary support for people who live extraordinary lives. And I'm here with Dr. Eric Keene today. We're going to be talking about low back pain and its relationship to hip mobility. But before we get into that, I just want to send a huge shout out. 3 of our elite physical therapists were in Steamboat Springs, Colorado this past week for a week where they took 14 exams. 7 of them were written and 7 of them were oral practicals in functional manual physical therapy. And they did an incredible job. This was Liz Arnold, Caitlin Housworth, and Jeff Walsh. And they came back yesterday fully exhausted, but also exhilarated at the amazing experience that both Eric and I went through not that long ago. And just a huge shout out to them, and hopefully they're going to be able to kick back, relax, and relish in their success. So this is our 5th episode, as I said, and what Elite Extra is conversations about health and wellness. We're talking to our elite physical therapists, our performance trainers, and Pilates instructors in all things related to our experiences in the health field and how much support we have for all of our patients and clients. And we'll also bring them along too to share some of their stories, and we'll even bring in some special guests. So we meet every Monday at 12:15. I'm Dr. Brad Gilden, and my business partner Stephen Krzyzewski. Either one of us are going to be hosting every single Monday, 12:15. So we're glad you're here with us today. And to kick this off, we're going to meet and talk to Dr. Eric Keene. Eric, welcome.
Thanks, Brad.
Glad you could be here. So first question that I'm sure you've been asked a bunch of times is, what brought you into the field of physical therapy? Why physical therapy?
Well, the original plan, honestly, was actually to be a strength and conditioning coach, working with high-level athletes, the collegiate, professional levels of the plan.
Okay.
But I worked in that sector for 4 years. I was working with athletes and everyday people as well. And everyone would come in and they'd be like, they'd be ready to train, but they'd be like, Eric, shoulder hurts, or my knee hurts. And there were always these limitations that I didn't really feel like I had the tools or the scope really to be able to address it. So I looked into physical therapy, and that's when I got into that. I went to LIU, got my doctorate of physical therapy there, and then I found residency here with Elite Health Services, and I've been here ever since.
So that's awesome, because you have the performance side of things, and now you have the medical background, so you can intertwine the two of them, which is something that is really beneficial to your patients, whether they're athletes or because we're all athletes at the end of the day. We all got to walk and move around, and so. So one of the most common things that I've come across in my area, over the past 18 years of treating patients is low back pain. And I know that many of the people watching have probably experienced low back pain, which is probably why they're tuning in. And those that haven't, I'm sure you're watching because you want to make sure you avoid it. So how prevalent is low back pain?
Well, the odds are really high that the people watching, and most people have experienced low back pain. 8 out of 10 people have a lifetime prevalence of experiencing low back pain at some point in their life. The good news about that is that about 90% of the cases actually improve without any intervention at all within 6 to 12 weeks of the onset. The other 10% require some kind of intervention, usually some kind of physical therapy, chiropractic work, massage therapy. Within that 10%, 5% require some kind of medication, surgery, or an injection of some kind. So we all have these stories of knowing someone. 8 out of 10 people is a ton. So I can remember as a kid, I think I was about 8 years old. My dad actually called my mom. I was at home with my mom, and he called her honey, I need you to come pick me up. And he was helping my older brother move some heavy stage lighting for a local play.
Okay.
And he bent forward, picked something up, and he was wreathing in pain.
Oh, wow.
Yeah, so he ended up actually having a very uncommon diagnosis, an L2, L3 herniation.
Oh, wow, that's high up.
Yeah, exactly. So
Okay.
yeah, usually L5, S1, or L4, L5.
Pain down the leg, or
Yeah, he was one of the 5% that, well, I guess within the 10%, the 5% that needed physical therapy for a while.
okay.
So,
Wow.
well, he did well with it though. He's no issues now, so good job, Dad.
It's amazing how debilitating, low back pain can be, because it involves everything. It's kind of that in between the upper and the lower body, and just I feel for anybody that is suffering from low back pain. So in terms of diagnoses, what are some of the different types of low back pain that people can experience?
Well, the most common one is known as athletic low back pain, also known as just a regular muscle strain. Usually it's about 70% of cases. And usually, like the name implies, it's more active people who were doing something and they're like, oh, I feel that in my back. And usually it just goes away on its own within 6 to 12 weeks, but if it doesn't, usually physical therapy is a good option for that one. After that, usually disc issues. That's usually about 4% of cases, a little bit less. But disc issues, usually, it affects people usually between the ages of like 40 and 50, 30, 40, 50, somewhere in that age range when the disc is still hydrated. Usually it can be accompanied with pain down the leg. Sometimes it's not. And usually the pain is worse with sitting than it is with standing.
Okay.
There's also SI joint dysfunction, which is actually one of the more mysterious and controversial ones. The SI joint only really moves about 3 degrees. 3 degrees, this is 180 degrees. The SI joint moves very little, so it's very controversial, but a common diagnosis that we see as well. With that is also facet syndrome. Sometimes if people wake up in the morning like, oh, my back feels really stiff, like I slept on it wrong, usually that's a facet issue. Mm-hmm. Another common one, usually 3% of cases, is stenosis. And stenosis actually is more of the older population. The research says 48 and older, which is not old, we know that, but usually 48
We're getting
and
close
older.
to that, so that's young.
That's definitely young. And the difference with stenosis and disc issues is that usually people with a disc issue will have more pain with sitting, and actually stenosis patients will feel better with sitting. And the disc patient will have more issue with, or feel better with standing, and the stenosis patient will feel worse with standing. So it's a good differential diagnosis in our head, or if you're experiencing those symptoms.
So with stenosis, what we're dealing with is really kind of that more narrowing, where it's creating compression on maybe the nerve material, whereas disc issues are creating compression on the nerves from a different way, because that disc material is potentially pushing on the nerves. So interesting, changing positions helps us diagnose what's really going on, with the patients.
Absolutely. So, and with that too, so those are low back diagnoses, but one that usually goes under the radar that isn't always looked at is actually with the hip, and that's called femoral acetabular impingement. So, also known as FAI, there's 3 different types, and FAI, you can have a cam lesion, which is a bony overgrowth of the femoral head through here, and then there is a pincer, which is a bony overgrowth of the pelvic joint, the rim here, and then there's a mixed. So the reason I bring up FAI is that if you're missing hip mobility, it can actually cause increased stress in the back.
So can you get into a little bit more how hip mobility can impact lower back pain, and how improving hip mobility can actually reduce someone's low back pain?
Yeah, definitely so. It's really all about force distribution. Sitting's a great example. If, let's say, your hips are really stiff and you're not able to have enough hip flexion, in a seated position, usually as we get older, our seated position doesn't necessarily get better, right? It's like, you kind of get into this slouched position here like this. It's like, what do you mean I am sitting up straight?
I'm going to back this up so we can see a little bit better.
Okay, sounds good.
There we go. My camera skills are not the
I'm probably gonna
greatest.
sit up in a sec, so maybe,
We're good.
Oh, that'll work.
That works?
Okay. Yeah, definitely. So,
Where's Mikey when you need him running the camera? It's our intern who's on vacation.
shout out to Mike. So, yeah, our sitting position doesn't usually get better. So we kind of are in this position, and trying to get
Comfortable for a moment.
trying to get up into your hips. And actually, if you're missing that hip flexion mobility, then it will be hard to sit up straight. And then if you're losing that, then all the lumbar flexion just puts stress on the disc and all the other structures in your back.
Yep, starting to feel that.
So there's 3 simple tests you can do at home to see if your hips might be contributing to any kind of back pain that you might be having. So the first one, what you can do is sit up tall on the edge of your seat. Lift up your one foot. Right, that's perfect. All right, that's perfect. All right, lift up your one foot a little bit, and staying tall, keeping your knee in place, try to move your foot out a little bit. This is a measure for hip internal rotation. If you're fine at home, like, man, I can't move my foot at all, then you're not alone. This is the most commonly lost range of motion as we get older. But the problem with that is it puts more stress on the lower back.
Mm-hmm.
So that's the first test. Just lift up your foot and trying to move your foot out a little bit.
Is it common for one to be tighter than the other?
It's very common for one to be tighter than the other.
Yeah, my left is definitely tighter than my right.
Yeah. And my right's tighter than my left.
See that? Put our 2 legs together and we got it.
Yeah, then we're good. The next one is a test for hamstrings. You can do it just sitting here at your desk. What you do again is just sitting up tall. Just try to kick your leg out as far as you can. You should be able to get pretty close to parallel with the ground. And you should feel a big pull in the back of your leg. And then compare it side to side and see if there's a big asymmetry side to side.
Pretty equal.
Pretty cool. Mine too.
Both pretty tight.
Yeah, equally tight. And then the last test is one for hip extension. So for that, I usually use the chair as balance. And you have one leg up, one leg down, and you try to make sure that you're not, that's perfect. You're not too extended and you're not too flexed. You want to kind of be in this neutral position. And then try to get your knee behind your hip without extending the back. So you'd want to be able to get a little bit ahead here, and that tells you if you have good hip extension or not. Some people will just be stuck here, like, I can't move, and usually that's a sign that one of your 7 hip, at least one of your 7 hip flexors is stiff.
So now that we have some ideas of diagnosing, what are some of the ideas, some of the things that we could do to self-treat hip mobility to help improve our low back pain?
Well, the number one key I'd say to be on this is consistency. There's a million exercises that you can do, but the key is just finding ones that really work into, I mean, we're all busy, and it's hard to find time to be able to fit it in.
Yeah.
So the key is finding that, like, that time of day that you can do it. So I put together for patients a lot, it's just simple desk exercises, and this really helps to loosen up the back. So I'm sure as you're watching, you're sitting, so these are great ones we could try right now.
Awesome. And the easier you make them, the better opportunity that people are going to actually comply and do them. And so, we try to make it as easy for our patients as possible, so that they're able to complete their exercise, because that's when they get better.
Exactly.
That's when they're able to maintain the changes that we make here in treatment. When they go home, if they have something that they can do to maintain the gains and continue to improve, then those are the success stories.
And it's always teamwork too. It's always having that dialogue with the patients, just to say, like, how is it going with this? And like, I didn't really get a chance to do it, and that's that's the trust they have in us to tell us that too. So
Yep.
yeah, it's great. So the first exercise, what you do, it's just called a seated pelvic tilt. You can put your hands on your hips and scoot to the edge of your chair. These exercises only take 2 minutes to do tops. So all you're going to do is just lift up your chest and kind of arch your back as you roll your pelvis forward, and then slouch back down. The slouch position is the one we usually sit in, so really helps to loosen up a lot of the muscles around your hips and back, just going back and forth with this one. I do this a lot when I'm driving on long trips.
Yeah.
Especially with my mentality trying to get there as fast as I can. I'm like, I don't want to stop.
Yeah.
So I'm like, all right, just arch my back a few times. That usually helps.
Good to do at a red light maybe too.
Yeah, exactly.
How about anything to do with breathing? Would you incorporate breathing into this at all to help create some relaxation?
So there's a natural rib motion with breathing. So you would inhale as you lift up, and then exhale as you slouch down. And doing that would really add to the benefits of the exercise.
Now, what if I have pain while I'm doing this? Let's say at the end of the motion, what would you recommend somebody does?
Probably limit the range of motion.
Okay.
It's very common to have more pain in the morning because the disc is still hydrated in the morning, and it dehydrates throughout the day, which is actually a good thing. So if you feel range of motion or pain during the range of motion, then just limit it. All right, so this is a perfect one. The next one, what you do, stay in the tall position and then just kick one of your legs. This is a great way to actually use the resistance of the hamstrings to strengthen the quad a little bit. Try to improve the muscular imbalance, the stiffness between the quads and the hamstrings.
So while I'm doing this, if I feel my lower back starting to round, what do you recommend doing there?
Re-cue.
Because it's so tight,
Yeah.
limit the
I'll
range.
probably limit the range, yeah. Definitely. Good question. And then compare side to side. You really only have to do a few on each side, but it helps loosen things up a lot. Another one, if you're feeling brave at your desk, if you work in a setting with a lot of people, you might not want to do this one. So at least what patients tell me. No one gives me weird looks here, but basically, this is the one where you would go down here. And then you would tuck your tail under a little bit, keep your core tight, and then just go forward and back. This
love
one
that
helps
stretch.
to, yeah, exactly. Hip flexor quad stretch. Just trying to loosen up the front of your leg here. And then you would switch sides.
Well, those are awesome exercises. I know you were putting something together as far as some additional materials. So I know watching some of these demos, they go pretty quick. Are there some additional things that people can get to so that they can review some of these on their own?
Definitely. So I put together a blog post on this. You can find it at www.erickeene.wordpress.com, and it's the latest post on there. It's titled "How to Help Your Own Lower Back Pain for Patients," and it goes over a lot of what I talked about with common diagnoses, and then it has, I think, 6 or 7 like 30-second to minute tutorials on how to help your own low back pain with some of these exercises, and I go over some bonus ones as well.
Awesome. So maybe what we'll do is we'll attach it onto this video as well so people can access it really quickly.
Cool.
Awesome. Well, this was great. This is going to conclude our 5th episode. Next week, we have a really exciting episode. We're going to have elite physical therapist and Pilates instructor Tara Gibson talking about pelvic floor, everything related to pelvic floor function, pelvic floor pain for both men and women. It's going to be an awesome episode, and just appreciate all of your support and tuning in to us. Again, that's going to be Monday, 12:15. Elite Extra. We'll see you then. Great job, Eric.
Thanks for having me, Brandon.
Got it.